Figure 4 passive range hold is going to be pulling your hip into full external rotation and passively, and then trying to contract those muscles and hold the position. We're really trying to close the gap between how much passive range of motion, how much we can use gravity or our other extremities to pull us into positions versus our active range of motion, which is our strength or what we have control of. We always want to grasp more of that passive range of motion. So to do this exercise, you're going to lay on your back like so. For my left hip, I'm going to use my hands to pull my hip into a passive range of motion. This is also a great assessment tool to see what your deficit is for the hip in external rotation. So external rotation is this movement of my hip. So I'm going to combine that with a little bit of hip flexion. If you are somebody who doesn't have a lot of flexibility, this is going to be too difficult for you and you might feel some hip pinching. If you do in the groin or the front of the hip, please defer this exercise. It's not appropriate for you. So for this movement, we are going to use our hands to pull us passively into hip external rotation and a little bit of flexion. You should feel maybe some glute stretching, hamstring stretching here. That is all you should feel. We're going to then contract the muscles responsible for this movement, trying to maintain that position. We're going to slowly release our hand and we're going to try to hold that position, thinking about externally rotating more and more. Once the time is up for the hold, we're going to grab, reset, and pull ourselves into our passive range of motion again. Most people, when they start to do this, will feel like their leg falls all the way out. That is a very big deficit between passive range of motion and active control. As you do this on a regular basis, weekly, probably you will notice some progress in your ability to control that more. One thing to pay attention to is as you try to control the movement, try not to let your pelvis shift side to side. We want to keep some good intra-abdominal pressure and stability here so that it is not going to be a spine exercise because this is a hip exercise. So last reminder, pull into it actively, contract those muscles trying to externally rotate, hold for the prescribed amount of time, and grab it and pull it back for the prescribed amount of reps. Again, you should notice progress as you do this, but you won't be good at first. So keep up with it and try to get more and more of your range of motion and have less and less movement on a week-to-week basis, and that's how you know that you're making progress.